Mental health, so vital for teaching kids how to work through their thoughts and their feelings. And here to tell us about a new therapy process is Dr. Myriam Glemaud, a licensed psychologist with Found Care. It's so nice to see you. Thank you for coming in. It is Mental Health Awareness Month. You have the shooting last Friday. Once again, parents all over the country, they're trying to reassure their kids and maybe calm some of their anxiety.
Absolutely, because mental health is very important as much as physical health, because when a child is going through emotional problem, going through some difficult moment, it is important that they can talk to somebody and that the parents are realizing there's something wrong with their child.
How prevalent is mental health for not just adults, but really for kids?
For children, in general, we would say it's about 20 to 30% of the population have mental health problem. But when it comes to children, it's even more important because children are still developing. Their brain are not fully developed. So they can go through some what we call adverse childhood experiences such as divorce, separation, grades falling, bullying in school. There's so many things that we have to take in consideration.
For pediatric mental health, when do you know that it's something more serious? What are red flags other than maybe my child is just having anxiety or perhaps depression issues? When do you know it's something severe?
One of the major signs is that the child is regressing. Let's say a child who already were not bedwetting and all of a sudden they're bedwetting. A child who doesn't want to see their friends. Sometimes we think that when a child is not speaking, the child is behaving well, but you don't know what's going on in the child's mind. And a lot of times, as you can see in the recent shootings we've been having in schools, is that we don't know what's going on in a young person's mind.
And they're not always able to convey it.
They're not able to convey because language is not something that's very natural for a child. So that's why play therapy comes into play.
Well, speaking of play therapy, tell us more about this technique.
Basically, play therapy is a counseling modality that we use just the same way for adults we will use cognitive behavior therapy. Play is a natural way for children to express themselves.
And you brought some toys to demonstrate.
Yes, absolutely. So here we have different toys that represent different ethnicity, because we have a lot of cultural diversity, and also different functionality. Sometimes somebody with a wheelchair, a profession. So we have different toys that the children comes in the room and they're able to pick any toys.
They can act it out.
They can act it out, exactly. So sometimes we can see like a child will take one person and then they will be hitting another one. So we know there's something going on with their life.
Because when they start playing, they kind of lose themselves.
Absolutely.
And they, oh wow, transfer
Absolutely.
it onto...
So they can really express their emotion without using words, which for us, for adults, it's something natural for us to use words because we're so used to that. But for children, it is something so natural for them.
Wow.
So we use those little toys that represent all kinds
Maybe
of
something
ways
going
of
on
life.
at school, on
Absolutely.
the bus.
And also for the teenagers, we use more like board games, because the teenagers are not going to use those little games as much. They use Legos, and so sometimes we use the board game that gives us an insight into the world.
You mentioned at the top of the segment that you work with Found Care. Tell us more about that organization.
Well, Found Care is a federally qualified health center located here in Palm Beach County, and we serve patients from 0 to 80, 90 years old.
Wow, what a range.
A big range. And we have our medical clinic where we have our primary care physician, pediatrician in the office. We have dental services also, and also case management for people who have chronic disease such as HIV and AIDS.
Dr. Glemaud, thank you so much. How enlightening. We appreciate your time. Mental Health Awareness Month, all month long, a couple weeks left. We appreciate it again.